My name is George Chamchikian and I'm 82 years old. And I was sent to Dr. Nemeth by my personal dentist who noticed that I was having bone loss in this area as a result of his x-rays. Dr. Nemeth investigated and found that I had infections both in my lower jaw where there was an implant and my upper jaw where there was another implant. So on July 2nd of this year, he performed surgery in those areas. Now, immediately after the surgery, I noticed, because I take my blood sugar twice a day, I'm diabetic, I noticed that taking insulin made my blood sugar go down to too low. Anyway, I consulted with my diabetic doctor and he had me cut out the insulin, and now my sugar is under control for the past month without insulin, but with glipizide, 3 pills that I take daily. Now, in addition to that, I waited for about 3 weeks after the surgery so that all the medication I was taking because of the surgery had cleared my system. And then I went to my doctor and had another blood test taken of a whole gamut of tests, blood tests. That was on July 22nd, and I compared that with the results of that test with the previous test that I had taken in mid-April, 3 months before. And here are some of the results of those. The creatinine test, which tells you how well your kidney is functioning. In April it was 1.8, and in July it dropped to 1.5, a significant improvement. My liver, which is a SGOT test, was running around 51. It dropped to 33, which is, the 33 is well within the normal range, the acceptable range. It should be less than 37. My triglycerides, which of course affect your arteries and can cause hardening of the arteries, I understand, was running at 179 for quite a while, for about 8 years. That dropped down to 71, which is well within the normal range. So I'm a lot less likely to get hardening of the arteries now than I've had in the past. In addition to those tests, what you can put a count or a figure on, I noticed myself that my sense of balance has improved, and therefore with a better sense of balance I'm walking somewhat better. My energy level has improved because I can do those exercises longer and I'm not as tired when I get done. And all I can say is it was well worth the money and the effort to see Dr. Nemeth.